Gerona. Thank you for joining me today. How are you doing?
I am well. Excited meeting you. How about you, sir?
All right, I'm fine. Welcome to this conversation. I want to get a spontaneous interview with you to learn about your background in nursing. So, this is just
Okay.
going to be general questions and answers about your nursing. I understand from your CV you have 8 years of experience. Is that 8 years of complete work in nursing, full time?
Yes, sir. Yes, sir. I don't have any nursing gap. I
No
work.
gaps. Okay, that's what I want to know. Yeah, you can just call me Tate Venice. That's fine. Yeah. Okay,
Okay.
so 8 years, no gap, and your specialization in this 8 years. Could you talk about the different things that you did in that time?
Okay. Uh, my first 2 years of experience was in the Philippines. So I was assigned in obstetric and gynecology ward as well as the medical surgery ward. But sometimes if we are understaffed, they will pull me out and bring me to ICU to help those patients.
Okay.
Then then the next 4 years I went to Singapore to work. I was assigned to work in the nursing home, which uh, which I was assigned in dementia ward. I handled 45 residents there, doing the daily routine because most of the residents there are dependent. I'm doing bed baiting, grooming, feeding them, giving oral medications, and providing activities for those the old people who got dementia. Then aside from that, I am the in charge of my ward. I'm doing the documentation, assisting doctors' rounds, then arranging their appointment from outside. Then, after my 4 years of experience in the nursing home, I decided to work in a hospital for a different environment. So I am currently working in the medical surgical ward in our in the hospital, but sometimes aside from the medical and surgical cases, we have psychiatric patients, and in the hospital uh, taking parameters, intake and output, uh, giving medication under the supervision of the staff nurse, and doing the simple nursing care procedure like doing NGT feeding, suctioning, ECG, and doing documentation as well under the supervision of the staff nurse.
Okay, so that's hospital care and it's also nursing home care for the most part. Any home care as well?
Home care, I don't have any home care experience.
Oh, that's okay. You have hospital and you have nursing home. Um, okay, so on the in the nursing home, that's where most of your mental health care was associated, right?
Yes, correct.
And this was mostly people, the people that required the most care, they were dementia and psychiatric.
Yes, correct.
Okay. And what are the kind of things that you would, let's say, what is a case of a very light problem that's easy to manage, and what's the case of a very challenging one? Could you describe the two differences?
Okay, I will start first with the most challenging one. Um, because every morning we need to shower the residents in the nursing home. Then one of our patients really don't like to shower. So what I do is I will not force the patient to do shower. Um I just do like sponging to her and change her clothing, then give her milk first. Then and another difficult part is those patients who are playing with their feces, like removing their diaper most of the time. So what I do is I don't force them to wear diaper, especially at daytime. So what I do is I make time to have their toilet patting. I make time to make their toilet patting. Then those easy ones are those like schizophrenia, but those schizophrenia patient, but very cooperative, like no.
Did you say schizophrenia?
Yes,
Okay.
I handle schizophrenia patient also, but there's one schizophrenia patient there who is very easy to handle. He is very cooperative. She is very cooperative, but she is also very quiet. I make time to talk with her, like open-ended question. Then I make time to provide her activities, not only watching TV, not only eating and sleeping.
So what are some of the activities that you inspire? So firstly, this is a 45 bed ward that you're in.
Yes.
Okay, and so within this ward, 45 beds, do you interact with typically, I don't know, 10 per shift or more than that, or all of them? I don't know. How many do you interact with per shift?
Like 20 plus of them, because mostly like half of them, because half of them are not interested and some of them are interested.
Okay.
So weekly we have activities, like for example, uh, I will bring them down in our garden. Then instead of having the dinner in our in the dining table in our ward, we will bring the dinner or the tea break in the garden setting. So which they can enjoy because different ambience. Then in the garden also we have pets like birds, rabbits. So I make them touch the birds and the rabbits. Then you can see on their face that like they are very happy with those with those pets. Then I take photos during their activities. Then I make like a bulletin board, so that their family can see that we're not taking only the health of their their family, but also their mental health.
That's really outgoing. That's very proactive. It's very humane. Is that something that is common in the Philippines or in Singapore?
No, nursing home in the Philippines is not so common, but in our nursing home, that's what our nursing manager wants us to do. So uh, she noticed me that I am good at this. So uh, I am the in charge. I mean, all of the staff in our nursing home, I am in charge of thinking what activities that I can provide for those residents.
What do you like the most about your job?
Because I can take care of those old people. Like I can take care of my parents and my family.
So you're learning how to take care of your family from your job.
Yes, because I treat my residents or my patients like my family.
I see. So you almost consider your workplace like a second home or second family.
Yes.
Very lucky
I,
patients you have.
sorry.
Very lucky patients you have.
Thank you.
All right. So mental health is something that attracts you for a kind of work. You enjoy that.
Yes, I
Okay.
really enjoy.
Especially the empathetic help, which allows you to share a little bit more than just routine tasks, but actually engage with them on a personal level.
Yes.
Okay. So New Zealand has many private private old folks retirement homes and villages, so where many old people live, and it's about the quality of life that they have. Does that sound interesting for you?
Yes, I think I can fit in.
Yes, I think you can fit in as well. This is where people pay money or their family pays money and they want good care, but also they want different levels of freedom based on their ability, and they want to interact with each other, and they want some structure as well sometimes, like different activities. Did you get involved in some structured activities for the group in the nursing home?
Structure for the group.
Though, like, I don't know, either games or maybe an event like a singer or piano player, or I don't know, something, maybe exercise, something like this.
As what I've said a while ago, my among the staff in our nursing home, we have a lot of staff in the nursing home, but the nurse manager in the nursing home, I am the assigned who will provide the activities for those patients because my manager see a potential in me that I am good at that.
Yes, so they can expand their business because of your abilities.
Yeah.
All right. You know what would be really interesting, Venice, if you could provide me with some photos of things that you're involved in, like a photo portfolio, like the different activities and some photos, maybe the ward that you're in. Maybe there's a couple of favorite people. Maybe the picnic place that you had. Different types of that would be useful. Okay, let's talk about your trip to New Zealand. So, when are you available to come to New Zealand? What is the time that you would like to come if you could?
February 2020.
February 20,
February 2022.
2022, February. Okay, so this coming February. Okay, so in order to be hired, you must be registered as a nurse in New Zealand, and it does take some time and it does cost some money. Would you look into this, please, and be sure about that part, the commitment of time and money on that?
Yes,
Have
I
you
can.
have you already investigated something about the nurse registration process?
Yes, I read it and I take some
Oh,
notes.
is that it right there?
Yeah.
Oh, okay. All right. You took some, so you're seriously looking at that. You would like to come to New Zealand, and is the move to New Zealand temporary for some short-term, some long-term work, or would it be permanent for residency? Which one do you prefer?
Permanent. I
Okay.
want permanent
All right.
residency.
Very good. Do you have anything else you'd like to say about your skills or what you would like to do in New Zealand as a job?
So aside, I never mentioned that I have training specializes in geriatric care. So
Great.
maybe that's where I get my skills in doing some activities for those
Okay.
men. I can provide you the certificate.
Please. Yes.
It's a 4-month course.
Yeah. All right. Beautiful. I would like to have that certificate, and any other certificates that you have, you can send to me as well.
Okay.
Venice, it's great to talk to you. We'll be in touch, and I look forward to future steps. I'm sure you'll be successful in your career. I hope you'll be successful in New Zealand, in your efforts in New Zealand, and I'm happy to help you.
Okay.